It's road construction season here in the Red River Valley, and some are a little worried construction on 32nd Avenue South could make things complicated for local medical facilities in that area. But as Valley News Team's Reed Gregory tells us, they've been prepping for this situation.
It's primarily that people need to account for maybe a couple extra minutes of their time in getting to and from the hospital.
If you've traveled along 32nd Avenue lately, you may have noticed an influx of orange cones and construction workers, as the city is currently in phase 1 of 4 to better that chunk of road. While the construction can be annoying for some, many are concerned about how this could affect one's trip to the hospital, as 2 of Fargo's major healthcare providers reside just off the avenue.
It's our understanding that it'll kind of really hit us later in the summer, but throughout the entire process, access will remain to the hospital and to the clinic.
Despite the ongoing construction, the medical center remains fully functional and operational, with no interruptions to patient care or emergency situations. However, they do say they will keep patients up to date on current conditions, as well as work with alternative means for patients who can't navigate the construction.
It's primarily that people need to account for maybe a couple extra minutes of their time in getting to and from the hospital. That virtual visits are always an option. They have been for quite some time. So if it does become too much of a detour for some individuals, that could be an alternative to look into.
As for dire emergency services, Essentia states those services shouldn't be impacted, along with their communication with updates for patients.
There is an emergency room here. Time is of the essence. They're going to make the effort to keep that point open. But we will do what we can to communicate internally and externally to patients.
In Fargo, Reed Gregory, Valley News Live.
The Sanford Health-owned clinic nearby says they'll adjust the construction by doing prescription delivery for patients if needed.